can we make the society, health is a right of everyone, and everyone in the country must have a right to access health. So there, I feel there's a role for a private partnership model, and this is very, very important to have a PPT participation from our country. And we need to
Mm,
improve the quality of education, we need to improve the quality of healthcare delivery, and we need to improve the participation of NGO and affluent people giving back to the community and society. Now, public-private partnership is one of the best example. It has been successful over the years in last almost 5 decades since our independence, and even in many other countries. So I would suggest number of people to join healthcare industry in a PPT mode and try to give back to the community. I wanted to
start.
share a couple of examples which I did as a partnership with a one of the best example I would like to share was a 4-hour-old boy who was thrown in the jungle. Imagine 4-hour-old boy thrown in the jungle, attacked by a wild animal, and he was almost beaten up by the animal to death. He was taken to the nearest medical college. They say it is very difficult to save a child with 4 hours with so much of injury, but they gave the primary treatment, and after that, he was referred to me for highly specialized surgery. And this happened in 2004. Imagine 2003 and 2004, a 4-hour-old boy. Now today, he is 20 years old boy. He is running and practically gone to college. He's playing very well. He's running like a normal child, playing volleyball and running like I wish I could share the video. But again, this is all what we could achieve is because of the sustainable giving back. There's an NGO based in Varanasi, which is called as a SOS Village. They took care of the child. After that, they made the child grow like a toddler to adulthood, and they took care of the healthcare, they took care of the education, they took care of the family requirement, and now he is a wonderful boy. Similarly, since 1981, when I returned back from England, I decided to go to tribal areas in the Madhya Pradesh, Maharashtra, and neighboring state, including Punjab, Uttar Pradesh, Rajasthan, and undertake plastic surgery in a remote area. My philosophy was, if these people cannot reach to me in city of Bombay, I can reach to them in their own city, in their own atmosphere. I used to carry a team of plastic surgeon, anesthetists, assistant, nurses, and everybody, instrument and equipment with me, go and operate in their own setup with the help of a local hospital and local community leaders. So for last 40 years, I must have operated more than 10,000 children. Now some of these children have become MBA, some of the children have become engineer, and some of these patients have in fact walked on the podium also with a team leader. One of the best example I wanted to share was a 4-year-old child which came from Nigeria. He was also burned very severely. There was a fire in the tent, and his father was working in a church, and he did not have much of money. So with a lot of charities, he was brought to Bombay. Almost he underwent 40 to 50 surgeries. Now he's about 17 years old child and a very healthy. So my theme has, we can make a difference. Physician as a physician, we have a humanitarian link between people and the nation. And one of the examples which I have been recognized and which Ms. Daljit Kaur will remember, acid throwing and vitriol. For last 40 years, I have treated more than 500 girls with severe acid burn deformities and with uh, and they have been able to walk like a normal children. So I would like to conclude with two saying. This is a saying by Ramesh Bhai Oja, who quoted, donation of time for service of people is much more valuable or even invaluable against the donation of money. The money we have donated can be earned back, but the time we have spent for the people cannot be regained back, and service to the people is service to God. And in last my 40 years, 50 years of medical services, I have found it extremely difficult, extremely demanding. It requires a lot of dedication. However, it has been exciting and rewarding. And in this sense, which I would say again, I asked for strength and God gave me difficulties to make me strong. I asked for wisdom and God gave me problems to tackle. I asked for prosperity and God gave me brain and brawn to work. I asked for courage and God gave me obstacle to overcome. I asked for love and God gave me troubled people to help. And I asked for favors and God gave me opportunities. At the end, I thought I received nothing I wanted. But however, I mean, in fact, I received everything I needed as a human being. And strugglers are exactly what we need in our life. If God allows us to go through without obstacle, it would cripple us. So finally, I was awarded the highest recognition by the Royal College of Surgeons of Edinburgh, honoring me as an honorary fellow of the Royal College of Surgeons of Edinburgh in 2004. Because of my contribution, I was awarded Padma Shri in 2009 by Honorable President Mrs. Pratibha Patil for my work on the community and giving back to the community, and honored with Sheikh Hamdan bin Rashid Al Maktoum International Award for humanitarian work in medical sciences. So, to conclude, I would say giving back to community, irrespective of whichever field you may belong to, is the key to success and key to maintain the sustainable development through the society. And once again, I want to thank uh, our host, Ms. Daljit Kaur, for inviting me and allowing me to share some of my thought on the sustainable giving back to the community. Thank you again, once again. Thank you.
Thank you very much. It was very valuable. Some of the points which really like motivates everybody that they have to give back to the society.